So I want to go over bridges, a foundational exercise for being able to squat, being able to bend forward and pick things up, being able to go up and down stairs. Super important muscle for building up the leg strength as a whole, and specifically getting your hip extension, taking pressure off of the low back, and helping to, again, do all those movements that are going to require a lot of power from your legs. I always like to start with this exercise when I'm teaching hips, low back, and knee pain, because each one of those problems is going to be built off of having a problem or a weakness or an inability to activate properly those glutes. So the bridge for me is absolutely essential. So the way you do the bridge, you're going to lay on your back. There's multiple variations that I'll go over this video, trying to look at the best ways to try and activate the glutes. What you're going to do is you're going to lay on your back. You're going to go ahead and have your knees bent, feet flat on the floor, shoulders flat on the floor, head relaxed, shoulders relaxed, and try and get an assessment of what your back feels like in that position. It should relatively be fairly straight, small curve in the low back. You're going to lift your hips up in the air, and as you lift your hips up in the air, you're going to think to yourself, you're going to try and feel, where do I feel the activation? What do I feel working while I'm doing this exercise? So as I'm lifting up, I'm trying to focus very closely on, do I feel this coming from my hamstrings, the backs of my thighs? Do I feel this coming from my quads, the fronts of my thighs? Do I feel this coming from my hips, the back of my hips, specifically the glutes, the gluteal area? Do I feel like this is coming from my low back? A lot of people are going to feel a lot of activation in their low back. And who's helping to get me up in the air? So as I'm checking those things, I want to try and get a gauge of who do I feel doing most of the work. Do I feel a lot of low back? Do I feel a lot of glutes? Who do I feel? What I should feel is I should feel almost exclusively glutes. I should not feel anything in the low back. The low back is on, yes, it is activating in a stabilization sense, but it should not feel like it's lifting or being strengthened by this movement. And likewise, I should feel a little, but not much, from the backs of my thighs, my hamstrings. They are secondary extensors. But I want to feel predominantly glute. In the clinic, we go over this in more detail. So as I go up and down, I feel those glutes engaging. What I'm looking for is I'm looking to try and get high repetitions here to build up a motor pattern for proper hip extension. I'm looking for about 50 repetitions with good form. It doesn't have to be 50, 45, 40, a high number basically, to try and make sure that every time you go up and every time you come down, you feel that same level of glute activation as you felt on that first repetition that you found all those glutes. You're having a hard time feeling the glutes. You feel like the low back is more dominant and you can't seem to shake it. A couple ways to try and activate that. As you're going up in the air, the first thing I cue my patients on is making sure that we are not trying to lift our waist in the air. As I try to lift my waist in the air, what I'm going to feel is that's going to almost trigger me to use my low back. As I'm doing this movement, what I want to do instead is I want to try and lift the groin, the lowest part of my groin specifically, towards the ceiling first, and not my low back. As I lift the lowest part of my groin and not my waist, I'm going to feel less of an impulse to kind of arch that back at the top of the movement, and more of an impulse to kind of thrust that hip forward, which is going to give me better activation of those glutes. Another good trick is to wrap a band around your knees. Wrapping a band around the knees, the glutes do, yes, hip extension, but also they rotate the hips. So my brain might be looking to try and get my hips up in the air and think, who can do this? Your hamstrings jump into play. Your low back actually can help initiate the movement, but the glutes are the only one of those two who can push, those three, that can push out and still get that hip extension at the same time. It's going to do the external rotation portion and the extension portion. By doing both of those movements together, it makes it easier for our brain to weed out low back and hamstring, and easier to find the glutes as we're trying to do that movement. Sometimes that pelvic thrust up, coupled with the pushing out of the knees, is going to help to activate that glute. Again, I'm trying to get to about 50 repetitions, trying to repeat. If I'm still struggling finding the glutes, I can pump up towards the ceiling, push out with my knees, come back in, out, in, out, in, out, in, and feel that glute contraction building. I would then go back up and down and try and repeat, trying to activate those glutes. 50 repetitions. As you get better and better at these, you take away the helpers, the band, the arms that are pushing down on the floor, and try to be able to get to the point where you can do it with your arms across your chest, no band around the knees, up, down, all glutes.